It's another day with the physicians where your health is our business.
Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what
You're welcome back to the Training Ultra of your regular program.
Dental caries, also known as cavities, are commonly known as tooth decay. These affect about 1.5 million Nigerians. They are caused by a breakdown of the tooth enamel. Cavities start small and gradually become bigger when they are left untreated. Because many cavities don't cause pain in the beginning, it can be hard to realize that a problem exists. Although dental caries are largely preventable, they remain the most common chronic disease of children between the ages of 6 to 11 and adolescents between the ages of 12 to 19. Today on your favorite Health TV talk show, The Physicians, our expert will be speaking to us about dental caries, the causes, symptoms, management, and of course, the complications. It's another interesting episode on your favorite Health TV talk show, The Physicians, where your health is our business. Today, we'll be talking about dental caries, the causes, symptoms, management, and of course, the complications. I remain Dr. Memuna Yusuf Kadri, and of course, I always will have my co-host,
Dr. Martina Agbere is my name. Welcome to your regular program, The Physicians, where your health is our business.
dental caries. You know, I like to always talk about when it comes to things like, because, you know, eat, brush your mouth twice a day, use toothpaste that has fluoride. And so when you have that pain, I don't know if you have ever removed any of your...
Don't even go there. The pain is not... I have.
Oh.
In fact, twice, Memuna. You won't understand it. When the pain comes, when the pain comes, it's even, I don't think it's almost, it's as close as having a labor pain. And the thing is that it comes, it's even worse at night. Yes, it's worse at night. If you lie down,
you from sleeping.
It prevents you from sleeping. If you lie, the moment you lie down, it's as if the thing understand that you want to rest. It starts. So the day that I had mine, I was early at 4 a.m. I was awake. I woke up. I was well dressed, waiting to leave for the clinic. You know why? Because I didn't want to be caught in the traffic. Because that pain never made the pain worse. So mine was that let it just get to 5 a.m. 5 a.m. I left. By 6 I was at the health center
Waiting to be seen.
I did not. I just told myself, no matter what they find. The doctor asked me, so they want to do an X-ray. I said, no matter what you find in that X-ray, good or bad, you have to take this out because I will not go home without extracting it. Yeah, it was that bad.
So it's good that we have an expert that's going to talk to us regarding dental caries and what causes it, why, what we should even do to prevent it, because it seems it's quite preventable.
Right, I use it, I do the normal things. So you will probably tell us the way to do it. Genetic chocolate, maybe genetic.
We don't. Well, we'll have an interesting guest on the show today. We'll be talking to us in details about dental caries. We'll be right back after this short break. Welcome back. If you're not joining us, we are talking about dental caries, of course, the causes, symptoms, complications, and management. And you've always had it. Go to your dentist twice a year. But some of us will not hear word. We'll still be doing anyhowness. But we have with us today in our studio a lovely dentist, and he's going to shine his 32, because dentist, if you don't have good 32, I don't know why you are called a dentist. We have Dr. Adedeji Kowobare, who is the lead dentist and CEO of Concierge Dentist NG. What that means is they are mobile doctors. So it's not every time you booking an appointment to go and see a doctor. This one, they will come to you. Doc, you're welcome.
Yeah, thank you very much. Thank
How you doing? Nice having you.
Yeah, thank you so much.
At last, Charlie is 32. At last,
yeah.
as a dentist, you have to show us.
Yeah.
I would do, if you don't have,
Maybe there's a secret, because most of the dental people that I've seen, the dentists, they always have a way of they're sparkling. The denture.
if the dentist doesn't have sparkling
The way it is even from the setting.
that don't not be dentist.
The setting.
Yeah, you have to start very well.
That is your brand.
Yeah, exactly.
So Dr. Kowobare,
Yes.
this dental caries we are talking about,
Yeah.
and we see it's something preventable.
Yes.
It's something that we can actually not get into.
Yes.
So what is dental caries for our viewers?
Okay, dental caries, also known as cavities, is the result of the destructive activity caused by bacteria on the remnants of food that we eat.
Food.
Yes. So basically, this is the question I get asked the most. Why do I have holes on my teeth? So when we eat food, this food, the remnants, even after brushing, some of them remain on the surfaces of our teeth. They are naturally occurring bacteria in the mouth. They are there and they are very useful to be there, so we can't eliminate them. However, these bacteria act on what we call the substrates. The food is what we call substrates, the remnants. When they act on these substrates, they produce acids. These acids dissolve the structure of the teeth, causing holes. It is these holes that then get deeper or larger that become what we call cavities.
Cavities.
Yes. Now, interesting thing is that the structure of the tooth, when we have what we call the longitudinal section of the tooth.
Is it
now,
what
the
you
longitudinal section of the tooth? Well, I will try to explain a little bit. So this is a tooth model. We have all the 32 teeth represented here, the upper jaw and the lower jaw. Then each jaw is divided into two halves. So we have 4 quadrants. 1 quadrant, 2nd quadrant, the 3rd quadrant, and the 4th quadrant.
Okay.
So the 4 kinds of teeth are represented on each quadrant. Now, the longitudinal section of the tooth from basic biology is when we break the tooth down from top down.
Down. Okay.
Yes, that's the longitudinal section of the tooth. So when we break the tooth up from up down and we open it, when we look at it, we have 3 layers
In there.
in there.
So this tooth is really deep.
It's
and
deep.
big.
So the interesting thing is that beneath the gum, in the bone, is the roots of the tooth. So depending on the type of tooth, they have different number of roots.
Okay.
For example, now the incisors and the canines, they have 1 root each, which are within the bone, covered by the gum.
Okay.
You know, God in his wisdom, while he created humans, puts gums to cover the bones. So imagine I'm smiling and then
It's
see the bone. It will be scary.
skeleton.
Exactly. So the roots are within the bone. It is through the roots that the teeth get connected to the remaining part of the body.
Okay.
So the blood supply and the nerves that connect to the brain enter the tooth through the roots. So the molars, the lower molars have 2 roots each. The upper molars have 3 roots each.
Wow.
Yes.
Any reason for that?
That's the way it's created. And then logically, you would think that it's important for the molars to have more roots because they're Exactly. So, as I was saying about the longitudinal section of the tooth, from the anatomy that we are seeing here, what we can see on the surface, this white part, is what we call the enamel.
Okay.
The enamel is the hardest substance in the body, harder than bone.
Seriously?
Yes, it is.
So it's not so easy to break?
No, it's not. It's the second hardest substance in the world, second only to diamond.
Where's the enamel again?
This is the enamel.
This one that we are saying before you are
It's the
saying.
enamel. Yes.
Some people have a cracked tooth. That means something really
Exactly. Something so forceful has been able to break the tooth. As hard as diamond is, diamond can also crack under the right amount of forces. So enamel can also crack. The bone can crack too.
Yeah.
So beneath the enamel is the second layer of the tooth that we call the dentin. So I was talking about the longitudinal section earlier. So when we break this tooth down from up down, we will see 3 layers. The first layer is the enamel, which is on top. The second layer is the dentin. The innermost layer is what we call the pulp. The pulp is what we refer to as the life of the tooth.
Okay.
It is inside this pulp that we have the blood vessels and the nerves that connect to the remaining parts of the body. Because from the heart, blood vessels, big ones, they arise, they supply blood to the rest of the body. So tiny blood vessels enter into the tooth also. From the brain and the spinal cord, nerves arise so that we can respond to stimulus. The same thing also happens. So you want to ask, how is it that despite this so-called security around the pulp, you can still have holes that can destroy or that can cause serious pain, like you were describing in the introduction? So what happens, like I said earlier, is that when bacteria naturally occurring in the mouth act on the substrate of food on our teeth or in our mouth, they produce acids. These acids, as hard as the enamel is, it can dissolve in the presence of the acids.
It's acidic.
Yes.
As the name implies.
Yes, so the acids can dissolve the enamel. So gradually, so the interesting thing is that when the hole is still at the level of the enamel, because the enamel does not have any nerves or blood vessels, you can't feel it. So there's a hole at the level of the enamel, you can't feel it. It keeps going deep. When it gets to the level of the dentin, interestingly, the way the dentins are is that they have what we call the dentinal tubules. These tubules can make you feel some sensitivity to hot and cold drinks or even food. At that point, you start feeling some sensitivity, right? But most people don't do anything at that point until it gets so deep to the pulp, where the life of the tooth is. So when it is at the pulp, when you eat at times, you feel some pain. Or at times when it's so bad, it gets so open that even ordinary air goes into it. The food goes there. You get some signals in your brain as response to stimulus.
From what you have just described now, it's very obvious that a lot of people are in trouble.
Exactly.
Because we don't respond, we do this knee-jerk approach.
Yes.
Okay, to solving problems.
Yes.
Okay, now, for people that have these, age-related, for children, you have talked about the causes, the kind of food we eat, acid coming to play, infection, getting to the enamel, the dentin, and then the pulp. What are the symptoms if you have this dental caries? What are the symptoms?
I've mentioned a little of them. Sensitivity, pain can be a symptom.
Pain that goes, radiates to...
Yes, pain can be a symptom of dental caries. Also, you could notice by yourself cavities, holes. So at times when the enamel is decayed, it will appear as a blackish discoloration of the tooth. So that could be a symptom and also a sign of dental caries.
That means something is happening, it's decaying.
Yes, it's
and
decaying.
then they just think that there's something, there's a change. It's not because it hasn't gotten to the pulp. They're not feeling that sensation. So for you, it's just a
what are the symptoms? How about the mouth odor?
Mouth odor also, it's also a symptom because by the time the bacteria has caused a decay of the enamel, that place becomes like a dumping site of food. So food gets lodged there. When the food gets lodged there, even when bacteria act on the remnants of food, they produce some sulfuric substances that have bad odors.
Okay. Before we continue, I want to ask you something. These dental caries, the cavities that you have, the fact that you have one, does it predispose you to having another one? Because oftentimes we hear people say, I've removed one extraction, I have a hole in my tooth, and another one is here. But there are some people, they don't even have it at all. So what do you think? Is it because if you have one, you are predisposed to having another one?
Not necessarily, because the teeth, based on my explanation already, are individuals. There is almost nothing, especially on the surface here, connecting one tooth to the other. They are individual teeth. However, a lot that has to do with dental caries and the mouth is habitual and has to do with hygiene. The fact that you extracted a tooth because it was destroyed by caries doesn't mean you will have to keep extracting.
That's good news.
Yes, it doesn't mean you have to keep extracting. As long as you can follow the basic oral hygiene instructions of preventing caries. So the issue most of the time is that the same habits that made holes to form on a particular tooth, this same tooth is beside this one, nothing is protecting this from this other one.
Okay.
So it's very possible that there's a hole forming on this tooth. So most of the time, when people go to the dentist and the dentist checks them and they have a hole on a tooth that is very painful, at times the dentist also tells them there's a hole on this one, but it's not as deep as this. Now, when the dentist say, well, we might have to remove this, the dentist also tells you at this point we can still feel this tooth. Now I'm talking about treatment. Most people say no, let me just face the one that I brought now. Now they face this, they practice, they go. And the unfortunate thing, if I might use that term for lack of a better word, about dental caries is that it is irreversible. Hey, once the enamel is destroyed, it cannot regenerate itself back. So if you remove this, there is a hole at the level of enamel here. The dentist tells you you can't feel it, but the dentist proves it to you using an intraoral camera or using a dental probe that is sticky. You say I will come back. Most people don't go back. They then go back in 2-3 years with pain. So they come with this theory of when you remove one tooth, you keep removing the other.
Okay, that is where the myth. That is exactly that's where the myth. And it's actually not true. Yes, it's good that we are diving into what people out there will really relate to. Yes, dental caries, not reversible once the enamel has been damaged. And if a dentist tells you, I'm extracting this and this other one has a little hole, let us just feel it. Abide by that. Feel it so that in 2-3 years you will come back screaming down and it becomes an emergency. We want to get to the street and talk to our viewers because this is a very interesting topic. All of you that will be eating midnight chewing meat so that you think you are doing somebody, you are doing yourself. Because most times you will take that meat or whatever you are eating and you will not go and brush your mouth. You will sleep on top of it. Let's hear from you what you know about dental caries. We'll be right back after this time out.
No, I've not had any course removing any of my teeth.
Not at all. Yeah, I have recently, about last year, I removed the one at the back. To avoid those things, I say brush regularly, maybe 2 times a day, brush regularly. Use Listerine mouthwash to kill the germs in your mouth.
Well, we have to, personal hygiene, we have to make sure we brush our teeth twice daily, in the morning and after we've eaten all we want to eat for the day. We should brush our teeth again. I think if the hole is not covered, it will extend to another teeth, another one. And when it extends, that person can end up not having any tooth again.
It leads into tooth decay. And tooth decay is not good for your teeth because it can affect other sides of your mouth too. It can also develop into cancer if you're not careful. I will not lie, I will not lie. I've not gone to the dentist though. But hopefully this month or next month.
Welcome back. I'm sure you are laughing the way I'm laughing because viewers from the street, they are telling us some people used to steal meat to eat. You take small chops, you'll be eating midnight, you will not go and brush your mouth. But you know what? We still have the expert in the studio who is dishing it out to us and telling us healthy habits are the best preventive ways of protecting yourself from dental caries. Now, Dr. Kowobare, are there different types of dental caries? And if there are different types, is there any age relation of those that have dental caries more than another age group?
Okay, yeah, the types of dental caries can be dependent on age, number one, and we can also have different types based on location, part of the tooth it's affecting. Yeah, so there's something called early childhood caries. So we meet parents at times when we maybe because I'm a mobile dentist, so at times parents, 1 or 2 parents will just call us to come into their house. We do check up for them and we're like, why do you do check up for your child? And they're like, do babies have those on their teeth? Yes, they do. So there's something called early childhood caries.
Chocolates?
Yes, not even chocolates. You know, it has a lot of names. It can be called nursing caries or bottle caries.
Is it a natural thing?
It's a natural thing. So at times where mothers, when they are breastfeeding, they sleep, the baby sleeps with the nipple in the mouth or the bottle, feeding bottle in the mouth.
Is that a problem?
Yes, it can cause caries because the surfaces of the teeth are coated with sugar for a long period of time.
And they sleep with it.
Sleep
The way we are
with
saying, I got a pacifier.
Yeah, but that's why they are pacifiers also.
Yeah, but
That's why they are pacifiers can replace the feeding bottle.
Wow. They don't encourage to use pacifiers.
Well, everything in life has its advantages and disadvantages. So if you look at it, the feeding bottle, leaving the feeding bottle that contains the milk or the baby food on the mouth of the baby, that's our time.
I don't want mothers to breastfeed the baby at night.
You shouldn't breastfeed.
Breastfeed, but you move your
and that is why, you know, so the reason why, so at night, saliva production is low.
Okay.
When saliva production is low, the pH of the mouth is reduced. It's highly acidic. And I said earlier on that when naturally bacteria, occurring bacteria in the mouth act on substrates, they produce acids. Now when the pH of the mouth is very, very low at night, the acidic condition is even helping more destruction to happen. So that is one of the reasons why we usually encourage people to brush before they sleep.
Even when you wake up at night, you can drink water.
Yes, because at least it's going to help to rinse off some substance. So we have early childhood caries and we have the adult caries. Then depending on the location, I think I've saw that there's the enamel caries that is located at the level of the enamel. There's the dentinal caries and there's also the pulpar caries.
That is the worst, I guess.
Yes, and there's also root caries at times. There could be caries on the surface of the roots.
Oh wow, that is dangerous.
Yes, because at times, because of the type of brushing
brush
that we use and the brushing technique, a lot of people think
talk about that one. No, Dr. Kowobare.
Yes.
Let's slow down that and let the camera speak to that person because some people will go all out. You give them toothbrush, they say no. That hard one, they talk say if he had, he would brush my teeth very well.
There are some brands that are popular for that, but we're not going to mention any.
Yes,
so
exactly.
Some people believe the other, the bristles. So your toothbrush has a handle and it has a bristle. So we usually recommend that you brush with a medium textured toothbrush, not soft. For babies, you can use soft textured toothbrushes. Not soft, not hard. And the reason is very simple. We want to protect the gums. I said earlier that all that is covering this surface is enamel. But on the root, what is covering the root surface is what we call cementum. Cementum is not as hard as enamel. So when people brush, either with hard brush or they brush with the wrong technique, instead of brushing, scrubbing up the lower teeth and scrubbing down the upper teeth, they scrub this way, which is a little bit easier.
This is easier.
Yes, it's easier, but that's not the right pattern to brush. When people brush like this with hard brush for a long time, they wear down the surfaces of the gum. When they wear down the surface, the root is exposed. That is why many times when they now take cold or hot drinks, some tingling sensation. Now that surface that is exposed can also get caries. That's what we call the root caries. Exactly.
Wow, so it's not just three now. Root is also part of it.
It can be root caries also.
Okay, so people use apart from the toothbrush, they use chewing stick also. Is that okay?
Does it have fluoride?
Well, scientifically, it's been proven that there are some little amount of fluoride present in the chewing stick. However, the only thing as regards chewing stick is that because the bristles are not as coordinated as that of the brush, it can tend to do some injury to the gum.
Okay, so now you know that we can have part of the complications. You can have infections coming in.
Yes.
With all that you have ruled out, if one does not take adequate care, what are the possible effects of dental caries on an individual?
The most popular thing is pain. Yeah, pain, decay of the tooth, eventual loss of the tooth. It could also lead to swelling, abscess. Yes, because
and that can go to the brain.
Yes, like I said, the canal, there's the root canal orifice through which the vessels enter and leave the tooth. So it's connected to the jaw. So some of those swellings you see of some people outside, it's because of a decay that started that wasn't taken care of. So it could be so bad to lead to what we call the Ludwig's angina. Ludwig's angina is submandibular abscess that can then compress on the lungs. It can lead to death.
Because it can affect the lungs and
exactly. Caries from the upper teeth can also affect the eyes and can also lead to the brain and cause a lot of damage.
Just caries.
Just from caries. So it's not, we shouldn't even look at it as a just anymore.
It's not just.
It can lead to so many things. So for that viewer sitting out there, what are your last tips on prevention of dental caries? And if for any reason they have, what should they do?
Okay, so without food, caries might not occur. So the first thing is diet. Refined sugar should be avoided as much as possible, because the sugar is the substrate that those naturally occurring bacteria in the mouth act on the most. So anything that contains refined sugar should be reduced. Yes, so diets should be controlled. We should take more fruits, vegetables compared to refined products. Apart from diet is then the brushing. We should brush twice daily and brush properly and use fluoridated toothpaste. Then the other thing is, which a lot of people don't do, which is one of the things that we are majoring on and advising a lot of Nigerians to learn to do, is to have regular dental checkup. Visit a dentist at least once in 6 months or twice in a year. Or I even tell people at worst once in a month. Or once in a year rather, visit a dentist, because like I said, most of the time some of the caries are incidental findings. You could see someone this year, treat the person this year, maybe scaling and polishing, and in 6 months you check the person again and there are holes on the teeth.
Thank you very much, Dr. Kowobare. You have really educated us on what you need to do when it comes to dental caries. Now it's telling us refined sugar, avoid it as much as possible, and of course avoid having to leave food substrate in your mouth, because that is a template for building up on dental caries, because bacteria will act on it and it breaks down. Don't forget to brush twice a day. It's not too hard. While brushing, brush appropriately. But most importantly, try to see your dentist twice a year. And of course, it's always a pleasure being on set. I remain Dr. Memuna Yusuf Kadri.
Thank you very much, Dr. Adedeji Kowobare. It's nice having you on our program, The Physicians. Of course, your health is our business also. And thank you, our viewers, for keeping a date with us today on this program, The Physicians, where your health is our business. We just talked about dental caries. For mothers, I want to tell you, even when you breastfeed your child at night, before you sleep, try and clean the mouth of the child. Do not leave the breast in the mouth of your baby. My name is Dr. Martina Agbere. Till next time, stay blessed. But remember to follow us on the social media handles, Facebook, YouTube, and of course on Instagram. We'll always be there. Anytime, you can send us a mail. Thank you and stay blessed.
Hello, my name is Dr. Isiawe. I'm an endocrinologist and the medical director for Rainbow Specialist Medical Center, Lekki. You're watching The Physicians. Make sure you stay tuned, follow them on YouTube and all the social media handles.